Dr. Armin Ernst, what is your competence? How come this interest in the health sector?
I started out as a physician over 20 years ago, and this is really what I've been doing all my life. I've taken care of patients. I've taken care of patients in the United States, in Europe, and really enjoyed it. But also felt that in order to really make a difference on a big scale, you need to take care of individuals, but you also need to take care of healthcare systems. And healthcare system transformation has really been something I've been interested in the last almost decade or so. What we have here in Malta, why we're here today, is really one of those great opportunities to take a step back and with the ability to invest some real money to reconsider and redesign and transform healthcare delivery as we know it today.
What is Vitals Global Healthcare, VGH, as we are used to it now?
Vitals Global Healthcare is the company that has gained through the bidding process the opportunity to work together with the government of Malta and the people in Malta to actually do this together.
Okay, at the moment, what are you doing in Malta? At what stage is the process? And if you can give us a basic timeline of what will happen.
Yeah. Well, the last 6 months have been incredibly busy. We put our teams together that we require here, and you've seen the quality of the leadership and the people who have come on board is really quite exceptional. We have spent a lot of time preparing for the necessary groundwork and all the buildings that we intend to put up. We have worked in detail with the planning authorities and the plans that had to be prepared, and have done a lot of the groundwork necessary for 2017 to become the year where a lot of the changes will in fact become visible.
By saying a lot of changes will become visible infrastructurally, you are mentioning now, but what about the quality of the health service that will be offered here in Malta? We will go into medical tourism later on, but to the Maltese, will they experience changes?
Yeah, I do think so. Malta is blessed with a good healthcare system and a lot of dedicated people who do their best every day. But everything can be improved, and I do think the constant push to try to be better and be the best is what we're really trying to bring. In collaboration with our partners, like Partners Health International, Barts Medical School, we are striving to look at healthcare as really a global and international, I wouldn't want to call it business, but endeavor and effort to increase the health of populations. And I do think with our mission of having the patient in the center and as the focus of what we're trying to do, you will see a lot of improvement in terms of team-based care, the experience at the hospital, and maybe even more of a focus of trying to prevent hospitalizations when possible.
And let's speak about GOZO now. You mentioned already Barts Medical School. What is the process there? At what stage are we? Because that is a new concept in Malta, especially in GOZO, of Barts Medical School.
Yeah. I'm glad you bring this up. Barts Medical School is really one of our valued partners in this, one of the best medical schools in Europe and the world for that matter. And their first endeavor in the establishment of a satellite outside of Great Britain. So Malta and GOZO should be quite proud that Barts really made this their very first such endeavor outside. We've been working closely with the government, with Malta Enterprise, with Barts Medical School, and Gozo General Hospital to bring the vision together. We have a sign-off on the planning authority's part and intend to really break ground early next year for the building. You may have heard the incredible interest already there is in terms of potential applications to the medical school, which should show that everybody's intent and hope for this to really work seems to be on the right track.
Gozo is the Gozo General Hospital is the only hospital in our sister island, and so you can understand that some persons may worry what will happen to the hospital. Will there be an improvement? Will the jobs be guaranteed? Will the Gozans and the Maltese be offered free healthcare there?
Yes, nothing will change in terms of access to care and cost. We are committed to that. It's part of the agreement between VGH and the government, and this being a partnership, the healthcare, the access to healthcare and everything will be as it was, but better. And with that I mean more services, the quality of services, wait lists hopefully being a piece of the past. All those things we intend to really see improve year after year after year. What I think Gozo and Malta should be prepared for is that the level of care, the size of the hospital, and the opportunities will improve. The hospital will be bigger, so we don't expect fewer, but more people to have an opportunity to work there. And what I have experienced over time is once a hospital truly becomes a teaching hospital, the setup changes. The whole feeling around the hospital changes because everybody elevates their game, if you want to put it like that. So it's going to be great for everybody.
Speaking about staff, you have managed to attract some important names for us Maltese. I mentioned Prof. Mark Brinkart, Albert Fanak. The Maltese consider them highly so and very credible in their ambit. What can you tell me about these two persons and the other persons who will join? I guess they will not only be Maltese but also foreigners.
Yes. Well, our goal is to not just develop the best healthcare system that provides the best healthcare that you could imagine, but also provide a fabulous place to work, no matter where you are in the organization. And for physicians, doctors, surgeons, it is a similar goal that we have. And I have really come to know and respect both of those colleagues that you have mentioned. They really do share our vision of improved care for the people of Gozo and Malta, and we are naturally aligned in those goals.
Two last questions. Medical tourism, how will the whole concept work, both in Gozo and in Malta?
Yeah. My preference actually is to call it international patients rather than medical tourists, because I think the concept is somewhat different. Medical tourism is dependent on individuals making an individual decision to come and seek healthcare for a specific problem at a place outside of their home. International patients also imply that we're talking about people who have real problems, who need real health care, and you have to ask yourself, why would they do that? It's not for tourism purposes where you have an opportunity to spend a week or two somewhere else. It is because they're looking for safe care, generally speaking, affordable care, or some other related reason. And there is a huge need in the world. It's a global phenomenon to do something like that. But what you have to do is you have to provide capacity, which Malta right now does not have. You need to have the beds, the capacity, and everything else. You need to provide...
You don't have capacity for the Maltese sometimes.
Yeah, that's exactly right. I mean, we are actually short of beds for the Maltese population. To just offer international patients space right now would be a disservice to the Maltese population. So you have to build the capacity, which is what we're intending to do. And you have to provide a level of standard that patients from the outside recognize. And for that reason, we aim to have all our hospitals certified by JCI, which is probably the leading international standard for hospital quality.